Dr. Ende again discussing this patient with patchy hair loss. This patient certainly could have a scalp flap, a scalp reduction, a rotational flap, really any of these flaps. However, nowadays, a lot of patients in my practice that have this type of hair loss will choose to have a hair transplant procedure. Now, it's not the immediate gratification that you get from doing a scalp flap or any other techniques I mentioned. Those immediately cover the area. Of course, you have a suture line there, but when the sutures are removed and the scar fades away, the results are typically very good. However, to accomplish a result in this patient with hair transplant with a completely bald area, she'll have a great result after just one hair transplant procedure. But in order to match the density of the surrounding hair, a second hair transplant is typically necessary. Now, many patients would be happy with just one hair transplant procedure, and I'll show you the results of that right now. Right here would be the results of one hair transplant procedure just 6 months later. Now, of course, as we've discussed in previous episodes, over the next 6 months, the hair will get longer and thicker and will look even better. But just after 6 months, this is what a hair transplant procedure could look like to a completely bald area. Most people would agree that this is a really good improvement from a very non-invasive procedure. And the patient was quite happy after this, but of course wanted to move on to an additional procedure, which we will go over in the next episode.